Namaskar, welcome to PK's classes. Today we'll study Linezolid. This is the structure of Linezolid, which is coming under the oxazolidinone antibacterial groups. So this is the primary structure, because of which we call it as an oxazolidinone. And there are many compounds. Main compound is linezolid. So linezolid, sutelizolid, epirezolid, radezolid, delpazolid, peptidylzolid. So these are some of the oxazolidinone compounds which are antibacterial. Some say it as antibiotic, but as per definition they cannot be said as antibiotics, because antibiotics are the substances which are the metabolic products of microorganisms used to kill or inhibit the growth of other microorganisms. But here these oxazolidinone compounds, these compounds are synthetic compounds. They do not have any microbial source. So we simply say this as the antibacterial substances. Then let us discuss the mechanism of action. Linezolid comes under those compounds which inhibit the protein synthesis by binding to the 50S subunit of ribosome. As we know, the bacterial ribosome has 30S and 50S subunits. You can also refer to our earlier classes on protein synthesis. Human ribosome is 80S, consisting of 40S and 60S subunits, whereas in bacteria it is 70S complex consisting of 30S and 50S subunits. So the overall process is messenger RNA first bind to the 30S subunit to form the 30S messenger RNA ribosomal complex, to which binds the 50S subunit and the transfer RNA to form the 70S initiation complex. Then with the elongation factors, there is elongation of the chain of the amino acids to form the peptide until termination occurs. Inside the 50S subunit there is the 5S ribosomal RNA portion, 23S ribosomal RNA portion, and in 30S subunit there is 16S ribosomal RNA portion. And linezolid binds to this 23S ribosomal RNA portion of the 50S subunit. Exactly where it binds in the 50S subunit, there are three sites: A site, P site, and E site. A site is the aminoacyl transfer site. Aminoacyl transfer site. So first the transfer RNA with required amino acid binds to this site. Then the P site is the peptidyl transfer site. Peptidyl transfer site. So there this peptidyl transfer occurs, the chain of amino acids are formed, and then E is the exit site where the the transfer RNA exits for a fresh cycle of this process, and linezolid binds to this A site of this 23S RNA portion of 50S subunit, and in this way it inhibits this initiation complex formation. 70S initiation complex formation is inhibited by linezolid, and this is the mechanism of action. So we can say that linezolid binds to the A site of 20S3 ribosomal RNA portion of 50S subunit of ribosome and inhibit the formation of 70S initiation complex. This is the 70S initial complex, where this is the 30S subunit, this is the 50S subunit, and this portion is the 23S ribosomal RNA portion. And as we said, to this portion, this site actually, this inhibits, this linezolid binds, and this 30S 50S union to form the 70S complex is inhibited. So linezolid can show its action in all these tissues: bone, muscle, skin tissues, lungs, and it also can penetrate into the synovial fluid, cerebrospinal fluid. So accordingly, linezolid can have use in pneumonia, both community acquired pneumonia and hospital acquired or nosocomial pneumonia. And linezolid is effective against the skin and soft tissue infections. In bone also it is effective. Then it is effective against enterococcal infections. Besides that, it can also be used in drug-resistant gram-positive infections, vancomycin-resistant infections, and usual dose is 600 mg twice daily. It can be used for oral or intravenous for 10 to 14 days. For enterococcal infections, it may be prolonged to 14 to 28 days. And the most common adverse event is gastrointestinal disturbances. However, linezolid can also inhibit protein synthesis in the mitochondrial ribosome. So, mitochondrial ribosome of human cells can also be targeted by linezolid. That leads to side effects like bone marrow suppression or myelosuppression, then lactic acidosis and neuropathy. These three because of the mitochondrial ribosomal protein synthesis inhibition. In addition, linezolid also is a weak MAO inhibitor, monoamine oxidase inhibitor. So it should be contraindicated with MAO inhibitors, and because of that MAO inhibition, there is increased level of serotonin, and it shows serotonin syndrome. Serotonin or 5-HT. So 5-HT, 5-hydroxytryptamine, is metabolized by MAO, and since it has MAO inhibition properties, 5-HT level increases, producing serotonin syndrome. So these are the common toxicity or adverse effects associated with linezolid. So this is all about linezolid. Thank you.